First of all, I'm Dr. Mendiola, a family medicine specialist. I graduated at FEU Medical Center, batch 2001. Also, I'm the product center owner in Lucena. Also, I work as former senior house officer in one of the hospital here in Manila, and also as program manager in the Department of Health Region 4. Also as former city technical officer in USAID. And I also serve as All-Star President of Rotary Club of Mandaluyong North. Okay? And one of my topic for today is all about our immune system. You know, maintaining a healthy immune system is, of course, the key to staying healthy and fighting cancers and all other diseases. And if your immune system is functioning properly, your body has no other choice, of course, to stay healthy. And first of all, I would like to ask all the viewers, how well do you know your body and how to maintain a healthy immune system? Excuse me. Do you remember the last time you were sick? Of course. And chances are you remember having a headache, a flu, and some kind of pain in your body. And after a few days or few hours, you are feeling better. And usually the blame is usually the virus or the bacteria. Of course, you know our immune system has different cells in our system. And one of the cells of the immune system is, as you can see in your screen, we have the platelets, the monocytes. Take note of the cells, the lymphocytes, the macrophage. There's a neutrophils, the killer cells, and the eosinophils. You know, these are the cells of the immune system. And as we all know, this is the cells which is found in our complete blood test. So, the complete blood test is composed of cells of the immune system, also blood parameters. The hemoglobin, it will check for your anemia. The WBC, as you can see in your slide, total WBC or white blood cells, which is composed of mostly the cells of the immune system. The neutrophils, the lymphocytes, the eosinophils, the platelets. And how does it work? How do you know if you have infections or if you have a disorder? First, we will check the total WBC. As you can see, there's a normal value. If total WBC is high, above the normal value, there is something going on in your system, in your body. And if the neutrophils is high or above 70, 40 to 70, there's a signs of take note of bacterial infections. And if the lymphocytes is high, above 45, there's some kind of viral infections. And the monocytes or eosinophils, there's parasitic or allergic reaction in your system. And platelet count is usually signs if there is a bleeding or signs of bleeding in your system. Blood test is parameter to check for our immune system, if it is healthy, weak, or sick. And complete blood test is different from our blood chemistry. As you can see in your slide, this is the result of blood chem or blood chemistry. The glucose, excuse me, is the sugar level in your body, fasting blood glucose. Fasting, which means no food intake within 8 to 12 hours. You will check your blood sugar level. And creatinine, as you can see in your slide, creatinine is parameter for waste in your kidney. So it is kidney parameter. Also, blood urea nitrogen kidney or liver problem. Of course, the blood uric acid, the total cholesterol, the triglycerides, which is the fats in your body. The HDL or high density lipoprotein is good cholesterol, and LDL is the bad cholesterol. Okay? And how does the immune system works? Diba? As we begin to explore the immune system, it is important to remember that our immune system has the ability to learn and remember different kinds of virus or organism or bacteria in our body. And as we all know, in our immune system, we have the lines of defense. The first line, the second line, and the third line. The first line, usually the external, usually is the skin, mucous membrane, hair in our nostrils, coughing reflex, and as you can see in your slide, there's a cancer, there's parasite, virus, bacteria. It will invade the first line. Oh, even saliva and our tears has antibiotic property. And there's the lining in our stomach is also one of the first line. It is ability to maintain our acidic environment in our stomach. It is important to maintain an acidic environment. But some virus pass to the first line. So the second line will sets in. The killer cell, the phagocytes, the phagocytic cells. There's phagocytosis in the second line of defense. And the third line, this is the one producing antibody, specific antibody to specific virus or bacteria. Example, there's a tissue damage caused by this bacterial injury. There's a pin. There's a release of these factors called histamine. And this leads to increase in capillary or blood flow. Increase in blood flow. As you can see, there is a red blood cell going out through the outer portion to form a blood clot. And there is a phagocytes, the yellow one, will engulf or eat this bacteria. And after their attachment, after eating, it will kill this bacteria and the degradation process. There's what you call inflammation. This screen or this picture happens inside our system. Outside in our system, particularly in our skin, there's what you call the signs of inflammation. Of course, there's fighting chemicals and virus in our immune system. So it will result these kinds of inflammation, the redness, the pain, the swelling, and the heat. And there is as you can see in your slide, there's a swelling in the hands. It is important to maintain our immune system in balanced state. Why? Because if our immune system is in balance, there's what you call overactivity or underactivity of our immune system. Underactivity means your immune system is weak. Overactivity means your immune system is hyper. And if your immune system is not balanced, okay, some kind of diseases will set in, particularly these autoimmune diseases. As we all know, there's a human body in your picture, in your slide. There's soldiers, what you call the immune response. And there's a bacteria, the upper portion of the picture. And the lower portion of the picture, human body is in the middle. Why? Because your immune system will react in your own immune system, in your own cells. The immune system will attack your normal cells, and the bacteria will also attack your normal cells. So, there's what you call the autoimmune disease. And the exact cause of these autoimmune diseases is still unknown. And what are the common types of these autoimmune diseases? What are the common? As we all know, there's a system, immune system. There is a brain, the central nervous system. In our lungs, that is a respiratory system. In our stomach, that is a GI or gastrointestinal tract system. And all of this has autoimmune problem. These are the common types of autoimmune disorder. In the brain, the common is the autism. In the bone, it is rheumatoid arthritis, which is different from osteoarthritis. In the muscle, there's what you call the psoriasis and eczema. You know, one of the testimony earlier is Carol De Jesus. And she has a full-blown psoriasis. And good. Her psoriasis is actually healed. The GI tract, the most common in the GI tract autoimmune diseases is diabetes. Also, one of the testimonies of Carol De Jesus is she also had diabetes, which is now it is controlled. And in the blood, it is leukemia and lupus. These autoimmune diseases the common. And one of my topic for today or tonight is the common autoimmune diseases found in the GI tract, which is the diabetes. What is diabetes? It is a serious complex condition which leads to increase in blood sugar level. And what will happen if you are diabetic? First, there is a yellow picture, and that picture is our organ producing insulin, which is the pancreas. In healthy immune body or in human body or immune system, the pancreas is responsible for producing this insulin. Insulin is the green one in the picture. And insulin will attach the glucose, the blue one, going to the cell. So our cell is the glucose is needed by our cell. But in order for the cell, for this insulin to be converted to energy, insulin is needed. In diabetic, there is no production of this insulin. So more glucose will stay in the blood. So if you check your blood sugar level, it is high because there is no conversion of glucose to energy because you do not have production of this insulin. So there's another slide. There's a glucose and there's an insulin. Insulin is needed by the glucose in order for glucose to be converted to energy. And if there is no production of insulin, that is diabetes type 1. If there is not enough production of insulin, that is diabetes type 2. If you are pregnant and you have increase in blood sugar level, that is gestational diabetes. As you can see in your slide, where does the pancreas located? It is located in our gastrointestinal tract, behind the stomach and besides the liver. So in order for us to be healthy, your GI tract will maintain healthy. And if there is uncontrolled blood sugar level, then what will happen to our body? There is some kind of complication. The patient can suffer stroke or cerebrovascular diseases, retinopathy or blind. Your eyes is become blind. Kidney failure or diabetic nephropathy, or in the heart, it is what you call stroke or MI or coronary artery diseases. Sometimes your sensation in the lower part of your body, particularly in your legs, is decreasing because there is sensory motor polyneuropathy. And that is what you call nerve damage. The question is your diabetes preventable or controllable? Of course. You can control your diabetes with a healthy lifestyle and proper nutrition. But some risk factor will not change. Example, if you have a family history of diabetes, family of history of heart problem, it will not change. But in your own, you can control your diabetes. It is important to maintain our lymphoid organ healthy, because this lymphoid organ is responsible for producing, to become healthy, our cells of the immune system. The thymus is responsible for producing the T cells, which is responsible for producing antibody. The bone marrow is responsible for producing the B cells, which is producing specific antibody. And how does this lymphoid cells or lymphoid organ become healthy, or your immune systems become healthy? Of course, balanced diet and additional vitamins, particularly the vitamin A, the vitamin C, the vitamin D, and the mineral zinc. And how does this vitamin works? You know, as we all know, vitamins, particularly vitamin A, is good in our eye, also good in reproduction. But you know, vitamin A is good in our immune system. How? It will increase in our lymphocytic response. As we all know, as have you seen in the previous slide, one of the cells of the immune system is the lymphocytes. And vitamin A is responsible for increasing in lymphocytic response, or lymphocytes. Lymphocytes is being produced by the T cells and B cells, the B lymphocytes and the T lymphocytes. Also, vitamin A is the one responsible for improving the white blood cell. And the white blood cells is composed of these neutrophils, the basophils, the platelet, which is the cells of the immune system. So vitamin A is important in our immune system. Another one is this vitamin C. As we all know, this vitamin C is good in our immune system. But how? You know, as you can see in your slide, the human body, the immune protective response, and the invaders or the enemy. The human body will serve as our headquarters, and the immune protective response will serve as our soldiers. And you know, vitamin C is the ammunition of our soldiers. So in order to boost our immune system, our body will need this ammunition, particularly in the form of vitamin C. So that's why vitamin C is good in our immune system. Another one is this vitamin D, or the sunshine vitamins. And one of the main functions of this vitamin D is to help activate the T cells, also known as the killer cell. So it can kill this virus and different kinds of pathogens or bacteria. So that is the role of one of the major role of vitamin D. Another one is this zinc, or the mineral zinc. It's good in our immune system in the form of this cytokine interferon alpha. And what are these? Are the functions of this interferon alpha or the zinc? It is responsible for inhibiting or stopping or prohibiting the replication of the virus inside your cell or inside the body of the victim or the patient. Also, this is the powerful sidekick of our immune system. As we all know, the lifespan of the Filipino is decreasing. Before, that is 100 and 85. But now, since 2012, the average lifespan is 68 years old. And still, the leading cause of mortality or death is cardiovascular diseases. The second most common is malignant neoplasm and cancer. And the third one is the lungs or the pneumonia. When we talk about pneumonia, the first thing that we think is the coronavirus, the COVID pneumonia. You know, coronavirus is discovered since 1960s. And the COVID-19 or novel coronavirus 19 is the new strain, the 7th strain of coronavirus. Before, the coronavirus is mild symptoms, but there are some strains that can be lethal, particularly the SARS-1, the MERS-CoV 2012, and this novel or COVID-19, which is discovered last year, 2019. This 3 strain is the lethal one. And the 4th strain is the mild one, like flu. And take note, still, there's no specific drug or prevention for this coronavirus. But some countries will start this coming week, particularly in Europe. Their vaccine is approved by their FDA already. And what is the common problem? Why does this coronavirus spread rapidly? Because the point of entry is particularly is in the eyes, in the mucous membrane, in the mouth, through ingestion, through the puncture wound or the abrasion. And what will happen if your immune system is weak? You will not survive if your immune system is weak. If you are infected with this kind of virus. And there is what you call the some habit of some people that can harm our immune system. And what are these factors that can harm our immune system, or the things that can harm our immune system? Of course, the smoking, the sedentary lifestyle or physical inactivity, lack of vitamin D or avoiding sunlight, proper nutrition, of course, dehydration or lack of water, and one of the most common thing that can harm your immune system is the negative emotion or the stress. You know, if you are stressed, think of this. Your mind is worrying. You have nightmares. You have indecision. You have negativity. And body will follow. You will experience headache, muscle twitches, fatigue. Take note, skin irritation. Skin irritation can trigger your skin problem, particularly eczema, psoriasis. It will trigger. Some questions, Doc, I have no skin problem, but when I work abroad and my work is too stressful, I develop skin problem, eventually eczema and psoriasis. And your emotion will follow. You will feel irritable, anxiety, depression, then follow the behavior. You will smoke, you will drink alcohol. Take note. Stress is related to increase in blood sugar level. It can trigger your diabetes. And let's talk about stress. And you know, 98% of diseases is related to stress. And what are these kind of diseases related to stress? As you can see in your slide, there's a lot of diseases related to stress. And the number one is the heart diseases, cancer, stroke, diabetes, asthma, depression. Okay, let's talk about this number one, heart diseases. You know, there are many different types of heart diseases. The valvular diseases, there's an incomplete closure of this valve or the door in your heart, that is the valve. There's cardiac arrhythmia or what you call the disorganized electrical signals in your heart, the beat in your heart. There's the aneurysm. You know, aneurysm is ballooning in your blood vessel. Not only found in the brain, but in your blood vessel all over your body. The thoracic aortic aneurysm is in the heart. Abdominal aortic aneurysm is in the abdomen. And brain aneurysm in the brain. The heart failure or dilatation in the left compartment or different compartment in your heart. The cardiomyopathy or the thickening in the muscle of your heart. And inflammation in your heart is the pericarditis. And the common in this type of heart diseases is still the coronary artery diseases. And what is the coronary artery diseases? First, there's a healthy artery. And coronary artery diseases is beginning, there's a complete blockade or near complete blockade in the blood vessel. Coronary artery diseases is called coronary artery diseases because coronary artery is responsible for the major supply in your heart, blood supply in your heart. The right and the left coronary artery. And if the coronary artery is blocked, of course, there's ischemia in the portion supplying this artery. There's a complete blockade. As you can see in your slide, there's ischemia or blackening or darkening the color of the portion supplying this blood. And what happened? Why does there is called the blockade? Because there's what you call the atherosclerosis. And what is atherosclerosis? It is hardening of the blood vessel due to deposition, take note, fatty substance, cholesterol, and abnormal cell. Atherosclerosis is caused usually by damage or injury to the inner layer of the blood vessel caused by, high blood pressure, high cholesterol, smoking or nicotine, and diabetes. So it is important to monitor your blood pressure if you are hypertensive. It is important to monitor your cholesterol level because one of the composition or content in atherosclerosis is fatty substance, cholesterol. Okay, the other one is the nicotine and of course the diabetes. And what is the treatment or medical approach in this heart problem? First, the angiogram. If angiogram is failed, then the angioplasty. It will insert a stent in your blood vessel. And another one is the bypass or coronary artery bypass graft, which is too expensive. One vessel is amounting to 300,000, 400,000. If you have a quadruple bypass, it is 1.2 to 1.6 million. So that is too much expensive. Question is, coronary or heart problem is preventable or controllable? We cannot change the factors, the risk factor if you have a family history. But you can limit your food intake or healthy lifestyle, or limit the saturated fats, cholesterol, and salts. Or eat plenty of fruits and vegetables, particularly in your slide, the picture in your slide, the FirstVitaPlus products. Of course, proper exercise, and according to WHO, plenty of fruits and vegetables. And the ideal product for this is, of course, this FirstVitaPlus. And what are the composition of this FirstVitaPlus? FirstVitaPlus has 5 vegetable in a drink with fruits. The malunggay, the dahon ng sili, the saluyot, the uray or colitis, the talbos ng kamote. We have a powder form or fista. And what are the benefits of this vegetable? First, the malunggay is good in normalizing our blood sugar level. It is good in malnutrition. Take note, antibiotic or antibacterial property, antifungal, anti-inflammation, and anti-cancer. And as we talked earlier, the vitamins needed by our body in order to boost the immune system is the vitamin A, vitamin C, vitamin D, and iron, and zinc. And you know, malunggay, which is high in these vitamins, it is good in our immune system, and minerals and electrolytes. And malunggay is called now the miracle tree or miracle vegetable. Another one is this dahon ng sili, which is good in stress, anti-stress, anti-fatigue, and immune booster. Also good in blood detox or blood detoxification because it can dissolve the blood clot in our blood vessel. It is responsible for improving the circulation in your heart and in your brain. So that is what you call the fibrinolytic activity. And the third one is the saluyot, which is high in antioxidant property, particularly in the form of vitamin E. Also, saluyot is good in our digestive problem. Take note, the diarrhea and the constipation, even ulcers. So saluyot is good in any kind of digestive problem. And the fourth one is the colitis, uray, or the spinach. That is good in mucolytic property and good expectorant. So colitis is good in respiratory problem, COPD, bronchial asthma, obstructive pulmonary disease, bronchitis, emphysema. Also, colitis has a hemostatic property, which is good in bleeding problem, particularly in women. If you have a reproductive problem, the myoma, hormonal imbalance, endometrial hyperplasia, bleeding disorder or bleeding problem. Hemostatic is responsible as what you call for controlling the blood flow or preventing the lysis. So hemostatic is usually controlling the blood flow in your blood vessel, in your system. And the fifth one is the talbos ng kamote. Talbos ng kamote is good in anemic patient. It is responsible for increasing your blood cells, or particularly the red blood cell. And also, it is the only plant with iodine, which is good in goiter patient, the nodular non-toxic goiter. Also, talbos ng kamote is good in increasing your platelet, particularly in patient with dengue. Or as we talked earlier, the platelet is one of the cells of the immune system. So, in order to help your dengue or the dengue patient, you boost your immune system and you increase your platelet. So, because platelet is one of the cells of the immune system. We have different variants, the dalandan, the melon, the guyabano, fruit and veggies with mangosteen, and the pineapple. The 5 vegetable plus dalandan, the 5 vegetable plus melon, or different fruits. You know, dalandan is good in any lungs or respiratory problem. If you have no available dalandan product in the house, you take melon. It is also good because of the 5 herb or the 5 vegetable. You know, melon, we have a lot of testimony in the reproductive system. If you want to get pregnant, take FirstVitaPlus melon. You know, melon is good in any reproductive problem. But if you don't have a melon in your house, you can take the dalandan, the guyabano, and different kinds of variants. You know, melon is one which has a high in vitamin A in these different variants. So one of the functions of the vitamin A is reproduction. Also, the immune system. Another one is the guyabano. You know, guyabano since 1976. There are some studies that guyabano is good in cancer patients. But you know, there's a multinational pharmaceutical company that opposes that the guyabano can treat cancer patient. So that's why it is being called no approved therapeutic claim. But since 1976, guyabano is being compared to one of the chemotherapeutic drug, which is the adriamycin. And guyabano is more potent 10 times than the chemotherapeutic drug that being compared in the previous studies. So if you have cancer, and guyabano is recommended. But how about the organ in the reproductive system? But if you have cancer, sample, if you have ovarian cancer, which variant is needed? Of course, the guyabano for the solid tumor and the melon for the reproductive system. You can combine the melon and guyabano. Sample, you take 3 guyabano, 2 melon. And the fourth one is the fruit and veggies with mangosteen. You know, mangosteen have xanthan. And this mangosteen is good in any central nervous system problem. Stroke patient, schizophrenia, bipolar, migraine, that is good. And the fifth one is the pineapple. You know, pineapple is good in digestive problem. Also, pineapple is good in mental state problem, the anxiety, the depression. Why? Because pineapple has a happy hormone, which is the serotonin, found in pineapple, also found in malunggay. So, if you have any mental health problem, anxiety, difficulty in sleeping, you take FirstVitaPlus. We also have gold line, the dalandan, the guyabano, and the melon, and the platinum line. The dalandan, the pineapple, and the guyabano. Platinum line is ideal for patient with many maintenance. Means, if you have complicated cases, for example, just like the case of Carol, she has cancer, breast cancer, she has diabetes, she has psoriasis, etc. Oh, by the way, let's congratulate Carol because her latest PET scan is negative. So, Miss Carol is negative for cancer. She's cancer-free. Okay? So the ideal product for these complicated cases is the platinum line. Also for cancer. And by the way, what is cancer? Let's talk about cancer. Cancer is abnormal cell, development of abnormal cell that divide or uncontrollable, cannot control, and then destroy the normal cells, the normal tissue. And this cancer is rapidly growing, fast growing. You know, the orange one with pink inside is the normal cell. And the green one is the cancer cell. As you can see, as we compare the orange and the green one is fast growing. So that's why, example, the breast tumor or breast mass, you are being diagnosed last December. After several months, 3-4 months, your breast is bigger and the tumor is bigger because this cancer is fast growing. Okay? That is the mass or the tumor. It will develop any flake in any part of your body. And some questions. Oh, my family has no cancer. How I have diagnosed with cancer? What happened? Why? Because only 5 to 10% is due to family history. And majority, the 90 to 90%, the environmental factors. And what are these environmental factors that can cause cancer? Of course, the number one is the tobacco. Then the diet, the obesity, even take note, even stress can trigger cancers. You know, as you can see in our previous slide, stress is majority related to diseases. 98% of diseases is related to this stress. And what are the common cancers nationwide? Of course, the lung cancer is the number one. The second most common and the most common in female is the breast cancer. And the third one is colorectal or colon cancer. What are the medical intervention for cancer? Of course, first choice is chemotherapy and surgery. So, you know, this is the medical approach in cancer patient. Oh, your tumor is too big. First, we go with chemotherapy. After the chemotherapy, we undergo surgery. After 6 months, we undergo radiation therapy. But some patient refuses medical intervention in cancer patient. They prefer healthy diet, fruits and vegetable. And what is that? That is immunotherapy. Immunotherapy means treatment. So you will treat your immune system, you will boost your immune system. And that is immunotherapy. If the patient has cancer, that is cancer immunotherapy. You will use your immune system to treat cancer. How? By stimulating or increasing your immune system to work hard or to kill, to attack the cancer cell. And that is cancer immunotherapy. And one of the best product in cancer immunotherapy, of course, is the platinum line and the titanium line, particularly the forte, the London forte. We have also the watermelon titanium, which is good in blood circulation, dehydration, heart problem, stroke, and cardiovascular diseases. Because of the property of this watermelon, which is good in blood circulation. Okay? We have the latest product, the 34-in-1 coffee, and this revitalized forte, fortified with vitamin C and zinc, which is good in our immune system, which is good in cancer patient because of cancer immunotherapy. We have different testimonies. Okay, this is my cousin diagnosed with prostate enlargement, 8 months taking FirstVitaPlus Gold. repeat ultrasound is normal. Oh, this is the nodular non-toxic goiter. As you can see, the nodules in the neck. Oh, this is one of my patient in medical mission in Pasig with diabetic. 500 plus sugar. The sugar is 500. The patient was brought in one of the hospital, and the patient was scheduled for amputation of his right feet, but the patient refuses. So the patient took FirstVitaPlus twice a day. Take note, the patient took the sweetened one, the Landan sweetened, twice a day. And after 10 boxes, the blood sugar is normal, and the patient wound, the gangrenous foot is healed. Oh, this is Nurse Jeneline. There's a patient in San Diego. This is diagnosed with COVID-19. Sir Romeo, the senior citizen. At that time, last April, Sir Noel, at that time, the available product in the United States is Guyabano Gold and Pineapple. So the patient VitaPlus product, no medication, home quarantine. The patient took this FirstVitaPlus, and the patient was able to survive, and he is able to donate at the cost of his plasma. So that is one of the wonders of this FirstVitaPlus. Oh, this is Romeo, and of course, thanks to Miss Mary Ann Dizon, the Satellite Center in San Diego. Okay, we have licensed the FDA, the HALAL, US FDA. And what is the ideal intake of FirstVitaPlus? Okay, first, if you want to prevent, so if you are normal, you want to prevent the diseases, you will take 5 to 6 serving of vegetable per day. And one sachet or one fish tub is composed of these 5 vegetable and fruits, 1 fruit. So if you want to prevent, just take FirstVitaPlus once a day. If you are sick, if you have maintenance, minimum serving of vegetable is 9. So you can take FirstVitaPlus twice a day, minimum. You have maintenance, you have cough and cold, you take FirstVitaPlus twice a day. But there is no overdose. If you are normal and also if you are sick, you want to take FirstVitaPlus 3 times a day, it's okay. 4 times, 5 times, it's okay. Okay, if you have maintenance, sample, if you have maintenance, you can remove your maintenance or wait. You have 5 medication, 5 maintenance. Simultaneously, take FirstVitaPlus twice a day. And after 3 months, you will repeat your blood chemistry. And if the result is normal, you can taper or decrease your maintenance. You remove 3, you still take FirstVitaPlus and take your maintenance medication. But we will reduce, we will cut your maintenance medication. And that is what you call integrative medicine. Okay? Your health depends in your lifestyle.